Now we'll move to the next stuff, which is known as rheumatoid factor. Okay, so we'll talk about what rheumatoid factor is. Then also we'll try to talk about when you actually need to do test for rheumatoid factor. Okay, so rheumatoid factor test, of course, is to diagnose all those inflammatory conditions of the joints. Okay, so this is a factor that is usually released into the body and the levels are going high. Okay, so it simply indicates that there's an inflammation going on in your joints. So rheumatoid factor test, we say that it's a blood test and it dictates the presence of what? Autoantibodies, or those hemoglobin M. Okay, they are directed against what? The FC portion of hemoglobin G. Okay, which is primarily used in what? Rheumatology. So it has very important applications in orthopedics. So let's quickly look at this. The role of rheumatoid factor test is, first of all, you use it in diagnosing rheumatoid arthritis. Okay, so many tests for it, but the rheumatoid factor test is what? Specifically what? Very important. So it helps to differentiate all those different types of arthritis, inflammatory, degenerative, and the rest. So differential diagnosis of joint pain. So a patient is feeling pains at the joint for a very long time, so this can actually help you to now what? Specifically say, okay, this is what is actually wrong, instead of thinking about many things. Okay, then it can also help you to know whether somebody will now come and have complications, like maybe whether rheumatoid arthritis will keep affecting this person for a very long time, that will lead to all those complications. So it will now make you know the type of treatment that this person will need. So it can also help in diagnosing all those Sjogren's syndrome, systemic lupus erythematosus, okay, tuberculosis, hepatitis, endocarditis, and also help you in planning for surgeries.